Assalamu alaikum respected doctors. Welcome to my YouTube channel MBBS and BDS lectures. Today's the video number on our YouTube channel is 360. Mean 359 same videos are present on our YouTube channel. And today our lecture is related to prosthodontics, and today topic is the overdenture. And today topic outline include number 1, introduction of overdenture. Second is the definition of overdenture, and third is the other names for overdenture or synonyms, and fourth is the requirements of overdenture, and fifth is the advantages of overdenture, and sixth is the disadvantages of overdenture, and on seventh number there is the indication of overdenture, in which condition we give overdenture to patient, and number 8 is the contraindications of overdenture, and number 9 is the post insertion instruction to the patient. Now first we start from introduction. Now overdenture, over mean above denture. The overdenture we give on the remaining natural teeth, a root or implant. Overdenture concept is a preventive measure in prosthodontics in which we make the denture on the remaining natural teeth. In the result, when teeth remain preserved, in the result residual ridge remain preserved, and PDL remain preserved. In the result there will be proprioceptive receptor in PDL remain preserved, mean preservation of proprioception and residual ridge resorption of patient. Now come to the definition. In definition, how we define overdenture? Any removable dental processes that cover or rest on one or more remaining natural teeth or roots of natural teeth or dental implant is called overdenture. Now look at this diagram. In this diagram there are two natural remaining teeth of patient. Now we do not extract these teeth, we make denture above these teeth. This is known as overdenture, mean above. Now look at another diagram. This is the overdenture, but not on remaining natural teeth, not on remaining natural teeth root, but above the dental implant. First we place the implant, then we place the overdenture above implant for better retention, better acceptance of patient. Now after definition, come to the other names or synonyms of overdenture. For overdenture, other name such as overlay denture also use, also called biologic denture because it preserves the residual ridge and PDL. Third, also known as telescopic denture, and overdenture also known as inlay denture, and also known as hybrid denture, and also known as superimposed denture, and also known as root supported denture. These all are the names which use for overdenture. Now come to the requirements of overdenture. First requirement for overdenture, basal seat should be healed. The mucosa where the overdenture land, these area should be healed. Second, basal seat should be firmly attached to underlying bone in order to not move during functional load. Mean the mucosa should firmly attach to the underlying bone. Third, fabrication of overdenture should be simple, mean construction, formation. Fourth, denture maintenance should be simple, mean patient easily maintain the denture. Next is the remaining natural teeth or root periodontium should be sound. Number 6, patient should easily manipulate the denture, mean easily insert the denture and remove the denture. Now look at this diagram. The remaining tooth periodontium is sound, there is no tooth mobility, therefore we give overdenture, means remaining natural teeth or periodontium is preserved. Now come to the advantages. And advantages, first advantage is it preserves the alveolar ridge. Why? Because there is a natural teeth, we give overdenture above natural teeth. When teeth is remain, alveolar ridge will be remain. Number two advantage, it preserves proprioception because it preserves the PDL. Third, natural teeth provide support to denture, which is absent in conventional denture. Fourth, natural teeth enhance retention of denture, which also absent in the conventional denture. Next advantage, it is inexpensive, aesthetic and comfortable for patient with congenital defect like cleft palate, partial anodontia, microdontia and amylogenesis imperfecta. Next advantage is the excellent patient acceptance due to its aesthetic and retention. Next advantage is maintain health of periodontium. And number 8th, it has a reasonable cost, mean it is inexpensive. Now come to the ninth advantage. We can easily change overdenture into conventional complete denture by extracting the natural teeth. And on 10th number advantage is it minimize the darkening and horizontal pores, because teeth are present. Horizontal pores does not dislodge the overdenture like conventional denture. Next is the less post insertion appointment. Like we already studied in immediate denture, there is a more post insertion appointment. We daily change the tissue conditioner, but here there is no concept. And then next is the roofless or open palate denture can be made in case of tori. Now these are the advantages of overdenture. Now come to the disadvantages of overdenture. The first disadvantage of overdenture is retained teeth are susceptible to caries. This is the first disadvantage. Second is the retained teeth periodontium is susceptible to breakdown due to plaque accumulation. When plaque accumulate, the periodontium breakdown will be start. The third disadvantage is the bony undercut limited path of placement of denture. When teeth is present between teeth and board, there will be bony undercut and it will limit the path of placement of denture. Now come to the fourth disadvantage. In presence of undercut, denture may be over contour or under contour. And next, aesthetic may be compromised in result of over contour or under contour denture. If denture is over contour or under contour, aesthetic may be affected. Now, after disadvantages, come to the indications of overdenture. The first indication is a patient having few remaining teeth. We give overdenture in order to preserve these teeth. In the result, there will be preservation of residual ridge and PDL. Now, second indication is indicated in a young patient because it is aesthetic and have good retention. Third, patient with congenital defect like cleft lip and palate, amylogenesis imperfecta. For these patients, overdenture will be inexpensive. Now come to the fourth indication, patient with high vault palate. We also give in high vault palate overdenture. Now next, in cases where extensive bone present around the tooth, mean tooth is retained, tooth periodontium is healthy, again we give the overdenture. Next is indicated in cooperative and motivated patient, because cooperative and motivated patient can easily clean this denture. Now come to the contraindications of overdenture. In which condition we cannot prescribe, we cannot give overdenture. Number 1, physically or mentally handicapped patient, because they cannot take care of the denture. Second is in uncooperative patient or under-motivated patient. Again, overdenture is contraindicated because it cannot maintain its good oral hygiene and patient and denture hygiene. Third is if there is a less inter-arch space between maxillary and mandibular arch, again overdenture is contraindicated. Next is the severe tissue undercut. If severe tissue undercut is present, again there will be insertion and removal of denture will be difficult. Number 5, in class 3 tooth mobility, overdenture is contraindicated. And next is the in case of bony or soft tissue undercut which cannot corrected by surgery, again overdenture is contraindicated. Now come to the 7th contraindication, vertical root fracture. If vertical root fracture is present, we should extract the teeth. Number 8, micro perforation of tooth. If there is a micro perforation of tooth, again overdenture is contraindicated. Next is the tooth fracture. If tooth is fractured, again overdenture will be contraindicated. Next is the horizontal root fracture below the bony crest. Again, overdenture is contraindicated. Next is the in case of broken instrument in root canal. Again, the overdenture will be contraindicated. Now come to the last topic of line is the post-insertion instruction. Which type of instruction we give to the patient after insertion of overdenture? Number 1, train and educate the patient to know the placement and removal of denture. Number 2 is the initially patient complain of bulkiness of processes and difficulty in speech, but we should educate the patient. You will be habitual with bulkiness with time. When you use it, you will be habitual. There will be no problem for you. Now come to the third post-insertion instruction. Instruct the patient to take small bite and eat with both sides of denture, not by only one side. Next is teach cleaning and brushing of denture to the patient. Teach how patient clean and brush the denture. Next is the teach about oral hygiene maintenance like toothbrushing, flossing, using of dentifrices, disclosing solution. In order there will be no plaque accumulation in the teeth, there will be no failure of overdenture. Next is a prescribe multi-tuft tooth brush with soft bristle. And next post insertion instructions, place toothbrush bristle at 45 angle to the gingiva of denture and give circular motion. This is the method to clean the overdenture. And next is prescribe the interproximal toothbrush if wide area present between teeth. In order to, there will be no interproximal plaque accumulation. Now today our topic is end, and we have Telegram channels and WhatsApp groups for you people. If you are MBBS student, mean from first year to final year, we have a channel on Telegram by name First to Final Year MBBS Lecture. There we daily share notes, videos, past paper, books. And if you are BDS student, we have a Telegram channel by name First to Final Year BDS lectures. And we have also WhatsApp group or BDS student, like first BDS group are boys separately per first year BDS student, and first BDS group are girls separately. There everyone can ask about books, notes, videos, any queries. Now we have second BDS group are boys only, and third BDS WhatsApp group are boys only. After that we will also make groups for girls also in future. Now all these channel and WhatsApp group links are present in description of this video. You can directly join by clicking the link. Now if you like my video, press the like button and share this video with your friends. If you new to my channel, subscribe my channel by pressing the red subscribe button, and also press the bell icon in order to receive my each new video notification. For watching my videos, I am very thankful to you. Thank you very much.